Hi everyone, Dr. K, today talking about PRP versus cortisone. So first, what is PRP? So PRP is platelet-rich plasma, which essentially means that you're doing a blood draw on the patient themselves that has the injury. You put their tubes of blood in a centrifuge, spin it down, and that separates the blood. And then what they do is they take a little bit of plasma and your platelets, and that is what they're injecting back into you. So it's basically using your own tissue to help your body heal. Whereas cortisone is an anti-inflammatory medication, also called a steroid. And so when you've had an injury that's lasted a year or more, this is where you start floating into PRP and cortisone territory, because it means like you've tried everything else and nothing's working. And so generally these things end up being kind of a last resort. So what I would say with the PRP is that the benefits is that it's not introducing anything foreign into your body. It's your own tissue. It's promoting healing because you're putting, cells directly at the spot that you need the healing done. So for example, if you have a knee injury, a shoulder injury, or like an ankle injury that just keeps, perpetually being painful, the drawback is that it does take weeks to months to start to notice the changes, and that's just because, again, it's helping you heal. So when you have a chronic injury, it's just not healing. Chronic inflammation is there, but once you start healing, that's where it's a gradual healing process. So a little bit of a drawback in that standpoint if you're in a lot of pain. Cortisone generally works within a few days, so people like that, the fact that it gets their pain down in a few days, but that doesn't necessarily mean that it's helping to promote healing. It just means that the pain is not there anymore, which may mean that you can do physio and other things to help, strengthen the joint, to then help your body heal itself. But it's not necessarily helping your body heal in that same respect like the PRP. With the cortisone as well, a lot of times people will get repeated injections every 3 to 6 months. And so when you're doing that chronically over time, even years, what happens is that the tissues can actually weaken and then eventually create more pain down the line. So ultimately you want to make sure that you're doing the things that help your body heal, because that is what's going to keep, the joints and the tissue healthy in the long term. So definitely some pros and cons with both of them. I think they both have an out-of-pocket cost if you don't have insurance as well. So those are also factors to consider when you're looking at PRP versus cortisone. But ask questions, make sure you for sure know what you're getting yourself into. They are both injected, so there is discomfort with that as well. But hope you enjoyed, and we'll chat soon.